Welcome back to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. May is Mental Health Month, and that's our topic today. I'd like to jump right back into our discussion by introducing my next guest to the program, Ms. Kacey Rodenbush. Kacey is a licensed marriage and family therapist and a psychiatric social worker with the HART program at the Monterey County Health Department Behavioral Health Bureau. Welcome, Kacey, and thank you for taking the time out of your very busy schedule to be with us.
Thanks for having me.
Indeed. So, Kacey, before we go any further, can you please tell me what HART stands for and maybe just briefly describe what the program is for our viewers?
HART stands for Home Alternative to Residential Treatment. It's a fairly new school-based intervention that works primarily with students who are at imminent risk of residential treatment. So we are in partnership with SELPA and serve special education students through a collaboration with Monterey County Behavioral Health and SELPA.
Okay, great. Well, thank you. So what are the signs and symptoms of mental illness, and how are they different in adults how do they differ from adults to adolescents to children?
Well, the signs and symptoms vary, and think of it as a continuum, because mental illness can be really severe, and then it could be kind of a little bit not as severe. So looking at different disorders, there are mood disorders where you could observe somebody having rapid mood swings and they're very irritable, aggression can show up. Depression, someone would have a really hard time getting out of bed. It essentially impairs their functioning. So if you look at children versus adults, you want to observe the behaviors. So you'll see difference in behaviors at school for children. So their grades might fall. They would have a hard time focusing on things. Adults wouldn't. They'd have impairment in functioning at their work, and so they wouldn't be able to maybe function as well as they would have. There's going to be a loss of interest in activities that would have ordinarily brought pleasure to the person. There's going to be some observable hygiene. Hygiene will show up, so you might not see, people might not be taking care of themselves if they're mentally ill. They won't be tending to their grooming. They won't take showers. They won't bathe or brush their teeth. Disruption in sleep. So there's going to be a sleep disturbance a lot of the times, maybe insomnia or sleeping too much. So not inability to get out of bed, and if someone is really depressed, they're really not going to want to do much. And sensitivity to lights, sounds, just the senses are heightened. There's going to be a disconnect from people in general. People that are actively in psychosis or experiencing psychotic symptoms, they might be responding to internal stimuli, things that aren't observable to other people.
Oh.
So they may see or hear things that aren't there, or people wouldn't be able to see them ordinarily. So that would be another sign.
Definitely. Some more obvious, I see, and some not as obvious, like way more subtle, aren't they?
And it's really about observing the behavior in the person and seeing, recognizing the changes. Also thoughts of suicide, if thoughts of suicide come up, or if adolescents, if they're engaging in self-injurious behaviors like cutting on themselves, they might be wearing longer sleeves to cover up their cuts, and that's also connected to mental illness.
So most often, who's the one that kind of calls to make the appointment? Is it typically someone observing someone else having these issues, or is it the person themselves?
Well, it could be both. You know, it's hard to reach out for help for people because of the stigma that's attached to mental illness. So teachers they're usually going to, they have their eyes open for these sort of signs, and school administrators, if children might be getting suspended, and so they might see there's a pattern in behavior that could be connected to mental illness. People could seek help for themselves and also for their children.
Okay, thank you. Yeah, it's, when you think about some of the subtleties, you're like, well, who's pointing that? Who's gonna, kind of be the supporting person to make for the, person having these challenges to make that leap, for help. So what are the risk factors involved with mental illness?
Risk factors, if there's a history of mental illness in the family,
Okay.
a genetic predisposition to mental illness is definitely a factor. In utero, drug and alcohol exposure. So if a woman is using drugs or drinking alcohol or exposed to a virus while she's pregnant, that can also influence how the brain develops, and then you could have mental illness as a result of that. Chronic medical conditions, so if somebody is in daily pain every day and it's maddening to be able to cope with that, and it's hard to escape, they can't escape the pain. Drug and alcohol use is also a risk factor. Of folks that experience mental illness, it's painful for them to go through what they're experiencing, so sometimes they self-medicate to escape that, and that becomes a vicious cycle because it goes around and around. People use to get away from the symptoms of mental illness, but then that also exacerbates the symptoms as well.
That's definitely a difficult situation.
Yes. And then also trauma. So traumatic experiences, a significant life event can sometimes trigger episodes. People that may have predisposition for illnesses like schizophrenia, if they have a very traumatic incident or one after the other, that could trigger psychosis and then develop into schizophrenia, those sort of disorders. So significant loss, when people go through grief and loss and they're not getting the support that they need, then that can become, they can fall deep into a depression, and then it makes it more difficult to reach out for help.
I see. So what should someone do if they recognize these signs and symptoms of mental illness in themselves or a family member? I guess we kind of just went over that one, but where to go, what to do, who to call right away, or is there what do you suggest?
Well, there are all kinds of programs and services out here in Monterey County. When you first recognize the signs, it's important not to ignore them, because sometimes parents have a hard time distinguishing between what's normal development for a child and what's mental illness. So seek going to a primary care physician first if they don't have a connection to a mental health provider, and then the primary care physician can make the referral. There's services available through the schools, as Rosemary mentioned earlier. And they can have services through their IEP, which is an individual education plan, or individualized education plan. And so that provides them with services. If they meet the criteria, they can get services through special education through the Monterey Office of Education.
Okay. Rosemary was mentioning earlier too, when you're supporting someone going through some challenges, you want to say, hey, look, straight up, I support you. If you're suspecting that someone, if you're noticing potential signs, symptoms, and you're suspecting something, do you have that same straightforwardness?
Mm-hmm. Absolutely.
Okay.
Just being direct about it, and not just acknowledging the problem for what it is. And the more education people have around mental illness, the better, because that it doesn't go away. It's not illness doesn't get better by itself. With treatment is how the changes are going to happen, and without the treatment, then they will get worse.
Okay, great. So can you tell me about the prevalence a little bit of mental illness in Monterey County? What does it look like?
Well, the thing with prevalence is there's really, it's hard to know because not everyone's seeking the help that they need.
Right.
So for the people that do access the treatment, then I would say it's definitely prevalent. There's factors that contribute to this, like the violence that is in our community, the gang violence and the drug problems and that sort of thing. So it's definitely prevalent. There's definitely support available for folks that are experiencing mental illness in themselves or their family members or their children.
So it's just difficult to know.
It's really difficult to know because not everyone has the means, number one, to get the support that they need, or have the information they need to access the support.
I see. So that's difficult to never be able to really measure, but I'm sure there's other benchmarks that are utilized in some way. So how can the stigma that's attached to mental illness be decreased and managed?
So the stigma, the more that you talk about, or people that have mental illness talk about their struggles with other people, accessing support, going to support groups. NAMI is great, a great resource here in Monterey County. It's the National Alliance for Mental Illness. It is a national organization, and there's a Monterey County chapter.
Oh, wonderful.
They have support groups. They have psychoeducational classes. There's family to family, and there's also NAMI basics for children that have detected a mental illness when they're younger than the age of 9, I believe. So they have ongoing support groups, and they also have ongoing psychoeducational classes. So the idea is that the folks that are experiencing this know that they're not alone. Mm-hmm. They meet other family or other people that have either themselves the mental illness or family members with mental illness, excuse me, and they build their support network.
Wonderful. So there's a place to go for just about everybody. Mm-hmm. There's a type of support group. And folks can go there and kind of be supported, let things out.
Yes. And when they're in crisis and they need somebody to talk to, it's more of a sustainable resource for them, so that they're not relying primarily on the professionals to help them, but they maintain a support network that will help them through the difficult times.
I like that, because whenever I call my doctor, I get a message, or the phone person that answers, the answering mm-hmm. service person, and so I like the idea of having a support network for the time of the week or whatever that you go there for the support, but also too for the other times you make friends and people that you can call upon whenever.
Yeah.
What kind of treatment is available for mental illness in Monterey County?
So we have for Monterey County, we have 2 divisions. We have the Children's Division and the Adults Services.
Okay.
The Children's has all kinds of, there's a school-based team. There are services from like the first 5, 0 to 5. There's the placement team, so there's children that are in residential treatment. They have an ongoing case manager that works with them. We don't have a lot of group homes in this county, but we do have, we send the youth that require residential treatment out to other counties when we can't place them within the county. And they get ongoing support. They get treatment through, for the family, the family will get support, so they'll get some family therapy. For the adults, there's, Rosemary mentioned the access. There's all kinds of this dual diagnosis treatment centers, so that people that are struggling with substance abuse and mental illness at the same time. There's board and care homes, the people that live full-time that aren't able to take care of themselves, so we have resources there too.
Great.
There's an entire transitional aged youth program. It's called Avanza, and they work with youth, I believe it's age 16 to 24, I believe. And they help them with the transitional age, so when they're trying to become more independent and they have mental illness that prevent them from, securing a job or learning how to maneuver public transportation and those sort of things, they have support that can carry them through. There's all kinds of groups that they have throughout the week, and it's just a wonderful resource.
Yeah, it sounds like it. Mm-hmm. So with treatment, are we talking about talk therapy, like counseling therapy, or are we talking like pharmaceutical drugs, pills? Okay.
So medication management is key, finding the right medication if the person that has mental illness requires it. Not everyone wants to take medication because there's also a stigma attached to that. Mm-hmm. So the outpatient treatment and in combination with the therapy is the best route to go in terms of treatment, not one or the other, because it's better to have both. And then if somebody requires a longer like residential treatment, then they can stay for 6 months to a year if they need to. Oh. But we try to keep them within the community and local, and at least my job is to try and keep them at home and not going out to residential treatment facilities. Okay. And helping to work with the families and help the parents get the skills that they need to support their kids.
Great. Yeah, and Rosemary mentioned a whole community. It sounds like the whole family, mm-hmm. whole community type of approach.
Yes.
So suicide, that's come up quite a bit. Mm-hmm. What if someone with mental illness shows signs or threatens suicide? How should that be handled?
Definitely should not be ignored.
Okay.
You want to respond immediately. If it's a youth, get the youth to a mental health professional. If it's an immediate emergency, you call 911. And what happens there is the person that is at risk of hurting themselves or other people, they'll go to either Natividad Hospital or CHOMP and to be assessed. It's called a 5150 evaluation, and that can hold them for up to 72 hours. So just essentially to keep them safe, because if they're expressing thoughts and they have an intent and a plan and means to do so, then it's not to be taken lightly.
Okay.
So getting a quick response. Early intervention is, Monterey County is huge on early intervention, prevention, and treatment.
So you said, I want to highlight what you just said. You said if there's a plan, if there's intent, if there's means, 911.
Yes.
Okay.
If they have, it seems like a plan that is imminent that they're going to be taking action. You can be proactive and remove things like weapons from the home, pills, sharp objects, that sort of thing, to keep the person safe. And then in the meantime, getting them help.
Okay, great. So that's imminent actions or imminent plans, and then I like how you suggested to remove things from the home, weapons, pills, etc. Get that stuff out of there. That's a good idea. So I think we have time for just about one more question. Well, the last one here I have is, how does drug and alcohol use affect mental illness? We know that it does, and in what ways? I mean, like you said, it kind of perpetuates mental illness.
It really does, and it becomes difficult to distinguish what's the bigger, or what's influencing what.
Right.
Is the mental illness affecting the drug use, or is the drug use affecting the mental illness? There's what's called drug-induced psychosis, and someone can be experiencing a psychotic episode while they're under the influence of drugs.
Wow.
So, it's a bad combination, because the drug and alcohol use, it impacts if the person's taking medication, then the medication's not going to be effective if they're drinking or using on top of that. So it becomes counterproductive, and the person doesn't ever get well.
And so then you just try to treat based on what's happening at the moment, or you have to make an assessment to figure out what's causing what?
Yes.
Okay.
And stabilize them, and getting them to a place where they can actually take in what they need to get the treatment that they need.
Okay. Well, Kacey, thank you so much. It was really good to talk to you. Thank you again for being with us. I just want to acknowledge that you do some great work in our community, and thank you so much for that.
You're welcome.
So if you'd like more information on anything you just heard from Ms. Kacey Rodenbush, please visit the Monterey County Health Department Behavioral Health Bureau on the web at www.mtyhd.org/bh. Right now, we're going to take a short break, but don't go away. We'll be right back with more of the Your Health television program.